Hi and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. In the video today I'm going to be looking at why switching between parts can be really important as a deliberate process. So this might seem a little bit odd because people often think of dissociation as a problem, that a person dissociates and that's a disorder and therefore something is going wrong for that person. Now that's if we look at the pathology of dissociation. When we start looking at dissociation as a defensive system, the way that we look at this within our clinic is that a defensive system requires skill and practice to do well. So we therefore think about dissociation in terms of switching between parts. So this is most relevant to Dissociative Identity Disorder or DID, that switching between these parts is something that needs to be understood and controlled. Therefore, we think about it as being a necessary component of therapy. It doesn't mean it has to happen. So lots of people have therapy where they don't really switch very much in sessions, but there's an awful lot of it going on outside in their real world. But within the therapy session, sometimes it's necessary to actually try and switch between parts for very specific reasons. And in this video, I'm going to go through what these reasons are, and then I'm going to look to see what the potential positive impact of this is. To begin with, we have to understand why switching takes place. There's a number of factors. So the first is that it's often a result of a trigger. So it's a trauma-related switch. It can take place when a person is feeling overwhelming emotions. It can take place in very specific situations. So the context, the environment becomes very relevant with this. It can just manage fear. So again, that's that overwhelming emotion. And it can also activate action systems. So there are certain times when a part might be needed to take effect or to have an impact in the world, for example, say going to work or managing in a specific situation, and that part comes out. So there's lots of reasons why it can happen. The essence of it is, though, for a lot of people with DID, this can feel very chaotic and feel very out of control. Like they're sort of going through the world and having a relatively normal time of it, and suddenly something happens and switching takes place. They might have amnesia for it. They may not know what's gone on. It can be very distressing. It can be very scary, and it can lead a person to feel very shameful and maybe guilty about things that the switched part has then acted on and done or said, and what impact or consequence that may have for them. There can be lots of reasons why a person might not want to switch. So they may actively block it, or they may be put as anything into effect to make sure that switching doesn't happen. So using, say, medication, drugs, all those kind of things. We also know that sometimes therapists will say that actually trying to dissociate or having part switching is a sign that everything is going wrong and that needs to be stopped. And some therapists advocate for there being no switching of parts and to try and actively avoid that and not have that present within sessions. And we've had people come into our clinic for treatment that have said that previous therapists have told them that they do not allow switching in sessions because they shouldn't be encouraging this. It's about stopping dissociation. Fundamentally, I disagree with that approach most of the time. There might be circumstances where that is useful, where you don't want switching to happen, but that would be very specific to a situation and not as a global rule. As a global rule, do not switch, have no parts emerge in DID, I don't think is helpful. And I'm going to explain why. The essence of it is that if you want to stop something from happening, like a behavior, say a switching, a dissociation, you have to master it. You have to be in control of it. So in order to have it not happen, you have to know exactly what it's like to happen and be in charge of that process. I don't think it's really all that helpful to think that I don't want something to happen, so I'm just going to completely block it and somehow just make it stop as an act of will. The way that we look at this within our clinic is that we establish a skill or a mastery over dissociation. So for example, a person might end up feeling like the dissociation is going to come on, that a switch might take place, and they can make a choice to either allow it to happen or not allow it to happen. That's what I see as being mastery of dissociation, and that's something we absolutely advocate and encourage in the work that we do within our clinic. So as a practical means, the way that we might set it up is to say to a person, okay, you don't like switching, you can't stand it, you want to be in charge of it. So what we're going to do is we're going to see if there's a willing part that would like to come forward for say 1 minute or maybe up to 5 minutes. and be present with or without amnesia. These all things could be factored on later on down the line, but to establish that presence within the therapeutic setting. So the person might be terrified, they might be really worried that something bad is going to happen, or that it's going to go wrong, or the therapist is going to get overwhelmed and run screaming from the room and all this sort of stuff. And we have to prove otherwise. So we set this environment up, we find the part that's willing, we encourage them to come out for say 1 to 5 minutes within the therapeutic setting, and after that time is done, the part then goes back in, the person is present, we reflect on the process. And that's what we start working as a skill set to practice. So it's done deliberately for the goal of achieving skill and mastery over that dissociation, that switching. The positive consequences of this are manifold. They can increase confidence from a person. So it allows them to feel confident that they might be able to one day be completely in charge of their dissociation, or maybe not have dissociation happen at all, depending on where they want to go with their therapeutic journey. It can reduce the fear that somehow dissociation would produce this bad effect, because the therapist has sat there and said to them for the last 3 or 4 minutes, so-and-so has been out, it's been absolutely fine, it's quite a nice conversation actually, and then they went back inside and you turned up and all was good. So that can actually allow a person to reduce their fear, reduce their sense that something terrible is going to happen because of the switching. That's a demonstration of safety, which is really important, because a lot of people don't feel safe with dissociation, so they become very avoidant of social settings or of certain people or places they might need to go, because they're scared that their dissociation is going to go out of control and the chaos will have this huge effect. If we're able to reduce it and have it done safely within a clinical therapeutic setting, the person starts achieving some skill over that, the confidence, the mastery, all those things take place. It also proves that the therapist can handle it, because some people really don't want their dissociation or want their trauma to have a negative effect on the therapist, and actually this shows it's a way of demonstrating proof that actually this can be done. And Richard Clough, when he wrote about this, the 10 essential components of good therapy for DID, what he said was one of them is you've got to demonstrate that you have skill. So for a person to be with a therapist working through their DID, they need to know that the therapist is capable of handling and managing the switching of parts. It's got to be done safely. The therapist doesn't get overwhelmed. The therapist isn't then going to reject the person because switching happened and maybe things got said. All done within safe limits, all done within appropriate and established boundaries that can allow a person to feel much more comfortable in the therapeutic setting, and that can be very productive for their ongoing therapy. So therefore, this deliberate switching, this therapeutically orientated deliberate switching, can have a real positive impact for that person outside in the world. It can establish their confidence, and it can establish their ability to then make a choice about whether to dissociate or not, because they have an ability, they have a sense of how dissociation is going to happen. They know what it feels like, they've had the time to discuss it, to show it, to demonstrate it, and to reflect on it. It can reduce the chaos, it can reduce the fear, and it establishes this level of skill. So a person can then go into an environment and go, I can choose not to dissociate because I've learnt how to dissociate. It's done properly. It's not chaotic. It's heavily structured, heavily organized. And when we've worked through people with this in our therapeutic settings, the conversations that I've had have said that these have had such a huge impact that they no longer feel so scared of it. They no longer feel out of control of it. And they have a sense of what it feels like when that part is emerging. And then we gradually start building in more consciousness of it, more awareness of it, more sharing of the space rather than one or the other. It becomes a much more collaborative thing. And parts that are willing to do this are often quite happy to jump in and take over for a period of time, because ultimately it's all about trying to make the person feel much more safe. And that's what the dissociation is for primarily in the first place. So I hope this video has been helpful. In terms of techniques, that might be something that we look at another time, but that's a very therapeutic process, very often unique and individual to the person and their therapist. I think for the time being, it's enough to be able to know that the actual act of wanting to dissociate can be a very positive and very therapeutic thing to try and achieve. So I hope this has been useful. Please leave comments as usual, like, subscribe, share these videos as much as you like. We're very appreciative of that. And in between now and the next video, please do take great care.